lifestyle and behavior are important parts of health, both prevention and treatment. You know, everybody knows this. They hear every day that they should eat better, they should exercise, that, they shouldn't stress out and relax, they shouldn't smoke or drink too much. This is common knowledge. But the question is, how do you actually make it happen in your life so that it's a natural part of your habits? It's not something you're struggling for. Hello, everyone, and welcome to Get Well and Stay Well, or How Healing Happens. It is wonderful to have as my guest today Dr. Mahtab Jafari. She is a professor at the Department of Pharmaceutical Sciences at the University of California, Irvine, otherwise known as UCI. Zot Zot. Go Anteaters. I love that symbol of the UCI. There you go. Oh, I'm sorry, Zot Zot. She's also a director of the Center for Health Span Pharmacology and Science at the university. An interesting topic. I think one of the unique, probably one of the most unique centers around the world. She's an expert in the area of aging and botanical extracts for aging, where she studies those as well as dietary supplements. And she's recently written a book that if you don't get enough information during this talk, definitely go and see. Dr. Jafari, would you mind holding it up? It's called Truth About Dietary Supplements. I have my copy at my office, and I'm not at my office. So take a look at this book. This is such a confusing and important area. A recent survey that the Samueli Foundation commissioned with the Harris poll showed that there's been over a 20% increase in dietary supplement use during the pandemic. And this puts it at about 80% of the population takes some kind of dietary supplements. And I have a feeling, and the survey actually bared this out, that they really didn't understand what they were taking, what was safe, what was not safe, how they were regulated, et cetera. And so we've got one of the world's experts here to help us do that. Dr. Jafari, welcome. Thank you for joining us and talking about this important topic, and looking forward to our conversation.
Thank you, Dr. Jonas, for inviting me. It's a pleasure to be here.
Great. I want to start off, as I do with most of my guests, trying to understand how they got to where they are. You've had a journey that has led you to this wonderful position where you're providing this kind of information, but what happened? How did you get there? Why did you decide this was an area that you thought was important to spend your time and life at? Can you tell us a little bit about yourself?
Sure, and I'm going to try to make it short, and I promise I'm not going to start from elementary school. I have a PharmD. I have a doctorate in pharmacy from UCSF, and I also did a clinical pharmacy residency there. And while I was in school and during my residency, I became more passionate about clinical research and also communicating scientific discoveries with the community, with people. So after I finished my residency, I was recruited on the faculty at UCSF. So I was on the faculty at UCSF. And to make a long story short, I also had a detour in industry. So I worked for Abbott Laboratories for 3 years as a senior research scientist and a manager. And I was recruited back to UCI in 2005 to develop pharmaceutical sciences as a new major for UCI. But if I look at my academic career and also my personal life, I always had a deep interest in wellness and creating healthy communities. So this is what got me here. And at UCI, once the major was developed, I also helped develop the department. I felt like my next phase of academic career, which is in a pretty mature phase right now, would be to develop a center to provide evidence-based education on various interventions and scientific discoveries when it comes to improving human longevity and health span. Because we've done a pretty good job with increasing our lifespan. So the average lifespan is now about 79 years. But when it comes to health span, which is the healthy years of our life, the average health span is about 63 years. So we still have a long way to go. So what got me here to write this book and really get more involved in educating the community about the use of dietary supplements is all the questions and comments that I've been getting for the past 27 years of my academic career and my career as a scientist on the safe use of dietary supplements, what to take, what not to take, what to worry about. And that's why I wrote this book. And my goal is to, inspire and educate our communities about the safe use of dietary supplements. I also love to teach. So I mentioned the detour at Abbott Laboratories. So after 3.5 years of a pretty good career in industry, I decided to come back to academia because I really miss teaching my students and also having my own lab, doing my own research. So as you mentioned, the focus of my research right now is on health span pharmacology, and I test botanical extracts and dietary supplements in various model systems, mainly fruit fly. So Drosophila is my main model system. And we've had great experiences. So over the past 17 years, we've tested a bunch of compounds and botanical extracts. And believe it or not, the successful ones are botanical extracts. So I have been
Wow.
focusing on these 5 plant extracts.
That's fantastic. And I know fruit flies are a great source of genetic studies and genetic information. So you probably have discovered and know quite a bit about that. Well, thank you for explaining what health span is. I'm older than 63, so I've passed the average age. I didn't realize that was the age. So what you're saying is that if I can stay disease and symptom free and functional for the rest of my life, I'm going to add to my health span in that area. Is
Absolutely.
that
Yeah.
right? Okay.
Yes.
And
And from what I know about your lifestyle, Dr. Jonas, you don't have to worry about anything.
well, I wonder, one question I'm sure that many of the listeners have is what's the role of botanicals in doing that? Because clearly you hear a lot about botanicals. Botanicals, we used to call them herbs, right? They're part of healthcare and medical delivery around the world. I think it's estimated 80% of the people, mostly outside of the Western world, still use herbs for health. So many of our drugs are derived that way. You describe that in the book. So the focus on botanicals is key. It's also wonderful to hear that you've had both industry, product development, and academic experience for teaching and the science, because the science is so key. And I know that uh, the uh, the School of Pharmacy there at UCI is brand new, isn't it? So,
Yes.
what a great thing to have something that focuses on botanicals and orients around so-called integrative practices in those areas. So, can you give us sort of a high-level summary of the main messages that you're trying to get across in some of the public communication and what you've put in the book around dietary supplements and their proper use?
Um, so, so thank you so much for this wonderful introduction. And as you mentioned, botanicals and plant remedies have been used around the world for thousands and thousands of years, and we are making a lot of progress when it comes to studying them in a scientific way. But I also have to say that sometimes our science is limited. So just because we don't have the right tools to study them, that doesn't mean that the efficacy is not there. But again, I want to go back to what you said, that they are practicing in a true traditional medical sense when it comes to around the world and globally. So that's something that I talk about in my book too. But as far as the message, if I were going to summarize the main message of the book, I would say that when it comes to dietary supplements, the consumers are pretty much on their own. So dietary supplements are not regulated. So the FDA does not approve them before they hit the shelves and before they hit the market. So if we purchase a dietary supplement in a store, that doesn't mean that that dietary supplement has been approved by FDA. So what that means is that the burden when it comes to safety and efficacy is on us. Having said that, of course, FDA gets involved with regulating them when they have enough reports of adverse effects, for instance, for a given dietary supplements. And that's when they start investigating the company or that specific dietary supplement. But before then, there are no regulations. So I want one of the messages of the book for people to understand that they really need to do their homework. But the good news is that there are ways to figure out if the dietary supplement that they are going to use is safe or is effective. And that's another message of the book, which is the last chapter. Most people who have read my book have told me that they like the stories because I share many personal stories, but also the last chapter because it is about how to choose the dietary supplements that an individual needs.
That's fantastic. Yeah. So in the Harris poll I mentioned just earlier, the majority of people taking supplements actually thought the FDA somehow approved them, or that they wouldn't be on the market unless the FDA had looked at them and said they were okay. But what you're telling me is that's not true. That there are things on the market that are sold that maybe the FDA has never even looked at. Is that right?
Yes, absolutely.
Yeah.
Yes.
And it's only after harm begins to occur, all right? So us as
Yes.
guinea pigs, that the FDA then starts to get involved to try to control that a little bit. So that's a little bit scary, right? I remember seeing a study several years ago in the Journal of the American Medical Association showing that at least for imported supplements, many of them that come from overseas, there was a fairly high contamination rate with things like heavy metals, for example,
Yes.
mercury, lead, and that type of thing.
Yes.
That's a bit concerning. We know those things are not good for us. They're
No.
toxic, and we might be taking them daily. So,
Mhm.
could you talk a little bit about what has to happen to know that a dietary supplement has some regulation, or that it's worth looking at? What kind of science needs to be done? You do a lot of this science. I had a patient actually today who asked me, well, I'd like to take curcumin, okay, to reduce the inflammation in my body
Mhm.
because I've got
Mhm.
joint pain, I've got back pain and arthritis. And so, she asked me, well, how much curcumin should I take?
Mhm.
And I really couldn't answer that question. I mean, if I go online and look, there's
Mhm.
suggestions all the way from maybe 500 milligrams a couple times a day to 8,000 milligrams. I saw one recommendation in those areas. So I really
Mhm.
don't even know what the dose is. And I'm actually not sure when and if you were to go on a higher dose like that, how much of that is actually getting absorbed. Can you talk a little bit about that?
Um, so you're absolutely right. Often we don't know where to start. So that is the big problem. And I was smiling when you mentioned curcumin because I just completed being serving as the co-guest editor of a Frontier in Nutrition journal on the preclinical trials, how to have higher quality preclinical trials when it comes to natural products. And in the editorial that me and my three co-editors wrote, the first paragraph, the opening is about curcumin, that we have about, I don't remember the exact number, but it's about 2,000 publications in a couple of years on curcumin and how we can use it for various diseases, but none of them is really conclusive. And when it comes to the dose, as you mentioned, we don't know what the right dose is. So, and other issues with curcumin or turmeric, some people choose to use it as a turmeric, the whole root extract. Safety issues are still out because, as you said, the contamination is an issue. One of the cases that I talk about in my book was this traditional Chinese medicine mixture that people were taking, and they were having liver failure, and they found out that that mixture was contaminated with high doses of heavy metal. So safety is an issue, dosing is an issue. So to answer your second question about what we can do, is that the good news is that we are making some progress when it comes to improving the science of studying dietary supplements. Office of Dietary Supplement at NIH 3 years ago put together a workshop and invited various scientists and botanical extract and natural product researchers to present talks on how to improve the research. And the outcome of that workshop was a paper that all of us, I was one of the speakers, that all of us collectively wrote to educate the scientific community and to kind of show them in a step-by-step fashion on how to improve the quality of these scientific studies. So I think we are making some progress, but as you know, science is very expensive. The gold standard when it comes to science in clinical sciences is randomized, blinded, control trials, and it is hard to do them. It is hard to control for confounding factors, to recruit patients, and to also have sound methodologies. But I think we are making progress. So that's the good news. And as far as the regulatory issues go, I use any platform that I can to urge FDA and our government to take a closer look when it comes to the regulation of dietary supplements. Because as you mentioned in that wonderful Harris poll that the Samueli Foundation published and is available to everyone, it was pretty scary to know that more than 50% of the people who responded to your survey think that their supplement is approved by FDA.
Yeah. Well, I know that would require some policy changes, wouldn't it? Because the
Yes.
current policy doesn't actually allow the
Yes.
FDA to do that. So hopefully we can push for that, so that we can make sure that we don't have to wait until we have liver failure to find out if what we were taking is solid. Now, the other thing that came out of the survey is there was a rise in dietary supplement use. Particularly in areas where people thought they were improving their immune system, or that they might protect them against COVID. Obviously, everybody wants to be protected, against COVID, and vaccines are probably the most simplest, effective way to do that. But people also want to know, how do I build my immune system in those areas? And so people had been taking things that they heard about that they thought might affect on COVID. Have you seen this also? Are you seeing questions about that? How do I not only protect myself against COVID, but are there supplements that might treat COVID in those areas? And is there anything to that?
So the answer is yes. And what happened with my book was that the book was ready to go in, publication actually not this past summer, 2 summers ago. And then the pandemic happened. And then I started getting more questions about dietary supplements. And then I started doing more research. So I put a pause on the publication of the book because I thought it was necessary to have a section on the use of dietary supplements during the pandemic and their efficacy, potential efficacy for COVID-19 prevention and treatment. So I added an appendix to the book. And in this appendix, I talk about statistics, like what happened during the very first month when the order for shelter in place was announced. That was March of 2020. The sales of some dietary supplements and botanical extracts increased in the range of 100 to sometimes 400%. I've had friends contacting me and saying that there are some typos in your appendix because you talk about a 200% increase. for instance, in the sales of vitamin C. And I tell them that that's not a typo. That's exactly what happened. So I'm not going to talk about all these different supplements that I have listed in the appendix. I talk about vitamin C, zinc, echinacea, elderberry, and I also talk about vitamin D. So if I were going to make a recommendation to our viewers, that would be to make sure that they have high enough levels of vitamin D, because I believe that the data is becoming more and more conclusive on the importance and on the benefits of having high levels, or normal levels, I shouldn't say high levels, normal levels of vitamin D. And especially, I would say that the very last study that was published 2 weeks ago, and it comes from Israel, showed that they looked at 300 patients who were hospitalized with COVID, and the patients who had the lowest levels of vitamin D had the worst symptoms and ended up being on ventilators and needed other interventions to manage their COVID. So if I were going to come up with just one take-home message, would be to make sure that our vitamin D levels are within normal range, and that is very important for our immune system.
Yeah, no, very, very important, not only for COVID, but also for influenza and various other kinds of functions, bone
Yes.
health, for example, and that type of thing. Very important. Now, you can't overdose on vitamin D, can't you? I mean, if somebody just goes out and buys some and just starts taking it, would you suggest before they do that, they check their levels to see if they actually need it, or would that be the approach?
I'm a big fan of checking vitamin D levels, because if our vitamin D levels are normal, most likely we don't need to take them. But if they are below, and this opens another question: what is considered normal? Because every time you review the literature, the normal range has changed. So my recommendation is, if the vitamin D levels are below 20, that means that the chances are that you need to supplement. Now the question is how much. I do not recommend high doses. I had a friend who contacted me actually 2 days ago asking me if she should be taking the vitamin D supplement that she takes. And I asked her how much, and it was 10,000 units. So that's a lot of vitamin D. And
Every day she was taking that every day.
yes, and
Okay.
and luckily she had only done it for like a week, so I asked her to stop right away, that we don't need 10,000 units. We need on average about, let's say that you don't want to check a blood level, so if we take anywhere from 500 to 1,000 units a day, we should be okay. But even in the case of deficiencies, taking vitamin D, let's say 2,000 units 3 times a day, for the most cases, it addresses the deficiency, and we don't need more than that.
That sounds great. So, there's a lot of cautions we've been talking about here, but there are times when nutritional supplements are recommended. They're beneficial at certain age groups and certain health conditions. You talk about that in your book, and could you give us some indication of when it is a good idea to consider taking some supplements, and if so, which ones?
So the best judge of what we need and how much we need is, we are the best judge, because we know our diet. We know if we are consuming enough fruits, vegetables, and nuts, and healthy fats in our diets. But if we don't have a good diet, which I like to recommend that we should have the good diet, I love the pictures that we saw in the video before these presentations, because if we all eat what you showed in that video, we are fine. We don't need to take any dietary supplements. So we are the best judge. And probably a good place to start is a blood test, to do a blood test to see where we are. But let's say you have no access to healthcare or blood test, and you just want to make sure that you're doing the right thing. I, you know, taking, for instance, folic acid for pregnant women, or women who are, trying to get pregnant, and during the lactation is very important. So that is something that we have to do, and there are many food products out there that are fortified with folic acid. The issue of vitamin D again is important because as we age, even if we had normal vitamin D levels in our youth, we may need to supplement. Um, B12 is another one because as we age, we don't absorb it as much as we
Mm.
used to when we were younger. So these are some, I guess, some examples that that are more specific to an age group or to a specific condition.
Yeah, so that's very interesting. You've just mentioned 3 different ages across the health span. You know, aging in which, there might be absorption issues and things like
Mhm.
B12 may be
Mhm.
important, pregnancy, folic acid, we need higher levels in that, and we just talked about vitamin D, which I think is universally recommended, for
Yes.
breastfeeding infants, right? Because
Absolutely.
there's not
Yes.
enough in breast milk compared to what they think is optimal in those
Yeah.
areas. I know sometimes young women who menstruate a lot, especially if they're athletes, may get, if they're vegetarian or something, they might get low in iron and that type of
Yes.
thing. So they need to get checked for that. And
Yes.
that might be situations in which a supplement is needed.
Mhm.
What about, as we get older, we tend to get on a lot of medications
Mhm.
and that type of thing. Are there times when we should be concerned about our nutritional status because of some of the medicines that we're taking and perhaps a supplement would be warranted?
So that's another good question, and these are the questions that I highly, highly recommend that we all check with our primary care provider, with our physicians and pharmacists, because it's not just an issue of the medication may kind of move us towards taking a dietary supplement that we never need. For instance, if we are taking antibiotics, I think the data looks pretty good for the use of probiotics because as we know, antibiotics completely wipe out any useful microorganisms that we have in our microbiome. So taking a probiotics may be helpful. But when it comes to other medications and adding other supplements, one issue that comes to my mind is the drug supplement interaction. And there are many cases of that out there. So, again, I highly recommend to share your dietary supplements or a list of your dietary supplements with your physicians to make sure that there are no drug supplement and also supplement interactions. So I don't know if I answered the question you
No,
have.
no, I think that's a very you did very much, and I think looking at those interactions, it can be very complex, and sometimes healthcare providers are not trained in that.
Mhm.
Is there a place that people can go to look that up? I know, for example, at Memorial Sloan Kettering, when it comes to cancer, they do have actually a drug supplement interaction
Mhm.
guide, and if you're a
Mhm.
provider there or even a patient, I think you can go on it and find that out.
Mhm.
Kaiser Permanente has some of that. There's something called the Natural Medicines Database, I believe,
Mhm.
that actually shows that, but that costs
Mhm.
something. You have to pay for that. Is that something that the UCI School of Pharmaceutical Sciences is going to help fill that knowledge gap so that we can find a good, reliable place to know where those interactions occur?
Well, first of all, thank you for this wonderful suggestion. I don't know if my dean is in the audience, but I will definitely bring it up to her because I think that would be a great idea and it would be a wonderful collaboration with the Samueli Institute in the College of Health Sciences. But to answer your question, we do have databases. And one of the databases that I talk about in the book is in the chapter. And as you were talking, I was actually looking for it. I will find it and I will tell you in a moment. But there is also another resource. It is called Operation Supplement Safety.
Oh,
So this is a collaboration between USU and also CHAMP, and the website
okay.
is opss.org. So Operation Supplement Safety is a website that provides amazing information, amazing safety information. They have a list of prohibited dietary supplements, how you can make sure that your dietary supplement is safe. how to learn about the ingredients. So that is a good one to look at, because they also have a section on side effects. So opss.org is one website that I recommend. And I also highly recommend for anyone who is taking dietary supplements to check the Office of Dietary Supplement website at NIH, which is ods.od.nih.gov. And if you can remember the website, if you type Office of Dietary Supplement and NIH in your Google browser, you will get to this website. So these are two of the websites that I highly recommend.
That's great, and we're streaming both of those websites now across the interview page at the bottom. So appreciate that. Yes, I know the Champ people very well at the Uniformed Services University, and they've really gotten into trying to make sure our troops are
Yes.
safe, because they take
Yes.
a lot of supplements for performance, for weight loss, etc. And so they've really gone into the science and give very practical advice about that. And if it's good enough for our troops, hopefully it's good enough for us too, right? In that
Yes,
area.
no, it
So
is. They have wonderful resources. They have a calculator. They have a table on the Operation Supplement Safety website where you can just answer questions, and then it tells you if you're doing the right thing or the right thing. And we fill that table pretty much in any course that I teach at UCI, because I think it's important to
that's wonderful.
know, am I doing the right thing or I'm not doing the right thing when it comes to dietary
That's
supplement?
wonderful. Well, the Samueli Foundation was involved in helping to train some of the reviewers there, so we know they're very good.
Oh,
So
good, good.
that's fantastic. Well, I appreciate those sites, and we've listed them on the bottom, and they're in your book. There is a trend going on now, and I think it maybe starts in California, as so many things do. Right? I don't live in California, but it's also coming over here and on the East Coast, and that is to go in and get supplements IV. So, normally people think about a supplement orally, but intravenous infusions of vitamins and minerals is becoming very popular, isn't it?
Yeah.
Can you tell us a little bit about the risks and possible benefits of that process?
So you're absolutely right. It's almost like every time I drive somewhere in Orange County and in Southern California, I see a new hydration, or they usually are called hydration lounge or hydration, facility or longevity facility. They come with different names. So the question that I always ask people is that when we put something intravenously in our body, we are puncturing a vein. So this procedure is considered pretty invasive, right? Because we are exposing the our internal body, our blood system, our blood circulation that can go anywhere in our body to infections. So if, God forbid, the practitioner who is putting that IV line in us is not doing it the right way, or there is a potential infection, that infection is in our body. That infection is going to go everywhere. So safety is a big issue. The other thing to remember is, just like dietary supplements that are not regulated by FDA, these sites, there is no oversight. So they don't need to be approved by FDA, for instance, to administer any kind of
Mm,
IV supplements. Having said that, there are some sites that have a physician on board, a nurse practitioner on board, or a PA on board, and they are monitoring what they are doing very carefully. So that's the
mhm,
caveat. For the most part, we can get the dietary supplements that we are getting through an IV, whether it's B12 or vitamin C or any other combinations, with oral supplements. So my question is, why are we exposing ourselves to an infection, or putting ourselves at a risk for infection, when we can take them orally?
mhm,
Now, the question is, another maybe good effect that comes from this IV infusion, and that's hydration. because people usually claim that, oh, I feel so much better. There are many of them, many of these sites that claim that they can help you with the hangover that you have. So what they're really doing is that they're infusing hydration. So they're hydrating you. So I recommend that you grab a glass of water, or more more than one glass, and drink a lot of water if you need hydration. And they may also have potassium in these infusions that may make you feel good. But you have to be very careful, because if you have predisposed to if you have heart disease, or if you are predisposed to get heart disease, you have to be extra careful, because some of the electrolytes that are being infused through these IV drips may actually be quite harmful.
Mhm.
So
Yeah.
this is
No,
my
that's
little summary on these.
very good. No, that was
IV.
a wonderful summary. I appreciate that. And if you have renal disease, for example, you may not be able to excrete some of it. And if you have more advanced heart disease, you can get overloaded even from water, right? Too much water
Yes.
can even be
Yes.
poisonous. That's not
Yeah.
usually the situation with people. They usually don't drink enough,
Yeah.
but it can be the other way around too. Well, we have some questions coming in from the audience, but before we get to that, I want to ask you about something completely different, sort of completely different, that you've also produced, that is becoming very popular. It's a course you developed called Life 101. What a great title. Tell us a little bit about that, and who is that meant for? Who should go and see that?
Yes, this is a course that is very close to my heart. I developed it at UCI about 8 years ago because I noticed an epidemic of stress and also poor lifestyle choices among our students. So I offered the course. I started offering it in 2013, and then I developed an online version in 2014. And 3 years ago, I received a grant from the University of California Office of President, UCOP, to develop the course and enhance it in a way that I can offer it to all students on all 10 UC campuses. So right now, any UC student can take this course. So the main goal of the course is to teach mental and physical health self-care. So students who participate in the course learn about basic skills to how to manage their stress, how to recognize it, and how to use various modalities to manage their stress. We talk about the impact of exercise, nature therapy, mindfulness, meditation, and many other topics as they relate to stress management. And we also talk about nutrition. And I also have a 1 hour module or lecture on personal finances. So I would like to call this course a course that we teach our students things that they don't necessarily learn in a college. So the UC version that is offered to all 10 campuses was offered about actually right the first summer of the pandemic, in summer of 2020. And then I moved forward and I developed a version of the course that is now available on Coursera, Life 101, Mental and Physical Health Self-Care. And that course can be taken by anyone. And it has been a very rewarding experience teaching this course on Coursera, because it connected me to students and teachers all over the globe. So I get feedback and comments from students who are taking the course in China, in India, in in Asian countries, in Europe. It's been an amazing experience. And I'm also using this course as an educational research platform. So I have been collecting data on how effective the course is to change behaviors and encourage students to adopt healthier habits. And the data is wonderful. I mean, they look amazing. Sometimes I think I should take this course maybe myself.
You should take the course too. We all should take it. You know, reading, writing, and arithmetic and health skills, right? That should become, the fourth leg of the
Mhm,
essential skills tool that people come out of school with.
mhm,
And I've got a future Facebook Live coming up by someone who does that for K through 12. who's
Oh, wow.
promoting educational health skills. Imagine if we all came out with health skills, what that would do to the health span. And imagine if we had an increased health span and even a part of the population,
Mhm.
how that would reduce our healthcare costs because we
Yes.
wouldn't have the diseases. And imagine the increased well-being and quality of life that would produce, and the increased economic benefit it would provide to the country, as people
Yes.
then would be able
Yeah.
to actually work
Mhm.
and contribute back to the economy. Anyway, I'll get off my policy work soapbox here in those areas, but such a simple thing. This course, as I understand, is free, right? You can
Yes.
go on Coursera. It's free. You've had, I think you said 5,000 individuals that have taken it. So,
Yeah, right now, I checked the enrollment yesterday for for our little chat today. I have about 5,100 students in the course right
yeah.
now.
All right. Well, thank you very much. All right. One last question. A number of questions came in through the audience, but I think we've answered most of them.
Mhm.
But I'd like for you to kind of end up, if you can, in one question that came in that said, okay, I'm an individual. I walk into a health food store or, some other grocery store, and I look at the dietary supplements and I decide, hopefully in discussion with my qualified practitioner, okay, that I want to get a good supplement. How do I know that one or this one or that one is safe? What can I do quickly, easily to try to
Mhm.
help sort through the wheat from the chaff?
Mhm. Very good question. And I wish I could give you a very easy answer and a very quick answer, but I'm just going to try to give you an answer that hopefully can help you. So, the first thing that I recommend everyone to do is not to walk into a dietary supplement store or a natural food store or any store without a plan. So, you need to have a list. So, based on the blood test and the conversation you had with your healthcare provider, hopefully you walk in knowing that you need to take B12 or you need to take vitamin D. Then the next thing that I would do is to go on the FDA website and also the Operation Supplement Safety website to see what are considered good doses. So 10,000 units of vitamin D is not a good dose. It's a very high dose. Once I have the dose that I need based on the conversation with my healthcare provider and also my blood test, then I would go on the FDA website and I type in the name of that dietary supplement to see if any companies that manufacture this supplement has had any warning letters, any injunction letters or seizure letters from FDA. And then obviously I would stay away from those companies. Another way to make sure that the dietary supplement that we are taking is safe is to go on consumerslab.com. I'm a big fan of this website. Um, there is a fee to join consumerslab.com, but I think it's one of the best investment. And by the way, I'm not, my research is not supported by consumerlab.com, and I'm not, there's no conflict of interest. But I like what they publish because they go and randomly grab dietary supplements from shelves and they check them for safety and also the accuracy of the information that they put on their labels. And that's a pretty good place that I would start.
That's great. So you've given us 3 sites there, a sequence to do that with the plan, the Office of Dietary Supplements at NIH, FDA to make sure that the company, so you put the
Mhm.
company's name in, right?
You
And
can
make
put the
sure they don't
company
have
name.
any warnings or danger in that. And then the
Mhm.
OPSS that we've talked about earlier. So thank you very much. That's useful. And then they should go and get your book to get more information. So
Yes. Yes.
thank you very much, Dr. Jafari, author of Truth About Dietary Supplements, professor of pharmaceutical sciences at the University of California at Irvine. Really appreciate spending the time providing this with this kind of important information in this important area. Thank you.
Thank you so much for having me.
Mhm.